Hello, welcome everybody to a new episode of IBD Essentials. It's a great pleasure today to host Sara El Ouali from Cleveland Clinic, Abu Dhabi. I have met her recently and I think she really made an impressive career, and I will not really introduce her completely. She will do it herself, but I found it really amazing that she is running the IBD Center at the Cleveland Clinic in Abu Dhabi as a female. And we will also probably talk a little bit later about difficulties for females in GI. I think this is still a problem in many of countries. And for us, being in North America or in Europe, maybe even more complicated. But Sarah, it would be really great if you could introduce and say a little bit about your pathway. Why did you become an IBDologist in the end?
Thank you very much, Axel. First of all, thank you so much for having me. It's great that you're able to give us voices like this. And so, my kind of progress or pathway started off. I'm actually a citizen of the world, lived in many different countries, ended up settling down in Canada, where I did most of my training or all of my training. Did an IBD fellowship at the Cleveland Clinic in Ohio, and then really kind of set up my practice at the Cleveland Clinic in Abu Dhabi in the UAE. And it's been fascinating. You learn as you go. You think you know, but actually the more you go, you learn that you don't know, and you're just learning as you go. But it's been a fantastic journey so far.
And how did it come that you said it just made it easy? I set up my clinical practice in Abu Dhabi. So how did you choose Abu Dhabi and not Germany, for instance?
This is such a good question. And I think like a lot of things in life, these circumstances happen. It was actually a family move. My husband was moving to that area. And so we moved together. And so really kind of driven by that. It's also a fascinating area of the world. I lived there when I was a kid with my family. We kind of lived all over. And it's an area I was familiar with. And so it felt natural to go back to it and kind of to give back to that area of the world.
Yeah, I like the term citizen of the world. This is also is really beautiful term. Before we really go into details, I would also like because I just recently learned it. Cleveland Clinic is something which is well known, but Cleveland Clinic is in Cleveland, Ohio, as you mentioned. But I learned that Cleveland Clinic is like a conglomerate of different clinics in Florida, in London, in Europe, and also in Abu Dhabi. So can you say a little bit about the setup of these different clinics?
I think it's a great question, and it's actually a privilege to be able to be part of this. It really all started off in Ohio. There are several branches in the US. There's actually a branch in Canada as well. There is now a branch in London and in Abu Dhabi, and it's great because, and what we've really kind of been able to build over the last few years, and especially with the leadership of Florian Reeder in Ohio, is where we're really able to build this, international or global program where we're doing things, collaborations that are clinical in terms of education, in terms of research. And it's been really just a fantastic tool to be able to, to just how you approach patients, how you approach research. We have brains from all over the world, but under the same kind of, quality of care and standards that are given by Cleveland Clinic.
Yeah, what I really like is that you can do research projects on the same level and same base, and you can exchange data because the clinics are really connected. And when I was invited, I was also very impressed by the educational moves you have. So you have conferences monthly with the different clinics together, and the heads have even closer meetings and exchange ideas. So this is probably something which is also very good for the fellows, for the residents, and for the full education.
Absolutely. I think it's such a privilege for the fellows, for even us, right, as physicians, for the nurses as well, but also for patients. So we have these, multidisciplinary team meetings. They're local, but also sometimes virtually with Ohio, with Florida, and with London. It's nice to get their perspective. They all have different perspectives on things. And it could be, the surgical perspective, the medical perspective, the nutrition perspective, and also for the fellows, especially in the Middle East and North Africa region, where there are very limited options for training, for learning. These are really great opportunities for them.
And how is then medicine practiced in Abu Dhabi yet now? is it like in the Cleveland Clinic where one person is dealing with the left toe and the other one with the right toe, or do you need to be more general GI? How does it work there? How is the setting?
Do you know what, Axel? It changed so much over the last few years. We used to be mainly doing GI, and IBD has just really, we've seen this in our clinics. It's hard to quantify because there are no research data on this, and we can talk about this in a bit. But we've seen an explosion of cases of IBD throughout the region, in fact, not just in the UAE. And we really went from, treating some IBD to treating, so some of us that are very specialized are mainly seeing just IBD. And it's really changed a lot over the last few years.
And IBD, so how is it organized? Are the patients coming from all over the country, just to your place or to some places, or are there also some practices more remote? So how is the system working? And also, how is the system? Is everything office-based, or do you have significant numbers of inpatients that are not that sick as in some countries? How does it work?
Yeah, and that again has changed a lot. We're getting a lot of referrals or self-referrals from all over the country. So throughout the day, you're going to see mainly patients from outside of the Emirates. And so within the UAE, you'll have patients from all over the UAE coming to you on a really kind of regular basis. We also have regional referrals, so patients coming from the region and a little bit more abroad to come and see you. And but we're lucky at the Cleveland Clinic because we do have that expertise. I do have to point out that it's not the same all over the region, right? There are a lot of areas in the region that are still lacking that type of, infrastructure, expertise in IBD. So we do get that kind of privilege to be able to take care of those patients there.
What I probably now have to move to more sensitive issues, at least sensitive issues for people who are not in the area. You are a female, you are a role model, really, and to be a role model in Europe or in North America, I believe, is much easier than in the Mideast area. And when I was visiting, was sometimes always, do I am here in the right position? Do I have the correct way? I know that Abu Dhabi is a little bit different than the rest, but perhaps you can share some information with us about this topic.
I think it's a fascinating question because it's something as well that's evolving a lot over the last few years. So when I first arrived at the Cleveland Clinic Abu Dhabi, I was actually the first woman in my department. But that didn't take long before we had a lot of other women joining us that are brilliant. And so there is a huge demand for female physicians, female nurses in that whole region. Not only female patients seem to be requesting that, but male patients as well feel very comfortable with us. And this is something I wasn't really aware of when I moved there. I thought, okay, I'll mainly be treating women. In fact, not at all. Male patients seem to also be very comfortable with female physicians and female caregivers. And so you could see now, we have fellows, they're mainly women. In fact, they're all women. We can see if you go across the region, not just in the UAE, if you go to conferences, a lot of speakers are now female. A lot of IBD experts in the region are female. But this was not the case a few years ago. It has changed dramatically.
And does it also have something to do with you? So if there is a one coming and showing that it may work, and because I believe sometimes mentoring is needed, and it's always the best if you have female mentoring females. When I thinking back about UG, when I tried to change certain things, I had to mentor sometimes the females. To be more aggressive or just to stand up and to speak out, and because a lot of colleagues are really brilliant, but they are sometimes a little bit shy, or they don't like to push into the foreground as men are doing. So tell me a little bit about mentoring, and we have several mentoring programs from the IBD. We are doing one. ECHO is doing something. I think this is extremely important.
Yeah, absolutely. And I think that's even evidence-based. There are studies that show that these actually mentorship programs really help. They're very beneficial for both parties. I'm glad you're mentioning this. I really think that it's because or thanks to mentorship that I was able to really kind of do what I was able to do over the last few years. And it's not just from female mentors. In fact, the best mentors have been male colleagues that, like you mentioned, push you, kind of show you the other perspective, and give you also opportunities for talks. They'll vouch for you, they'll advocate for you. And I think really that's extremely important from the very beginning.
Yeah, and I think we need really role models like you who then can stand up and bring the crowd. And it seems to be very successful. And in my personal opinion, in most of the countries, it has been for quite a while that females were staying at home and the whole talent was not really used. And for men, I always say it's a little bit easier because the problem with the childbearing and the time where it's maybe a little bit difficult is definitely with the women. You can take care of the kids and you can share all these responsibilities, but these particular 9 months probably cannot be really shared. Any advice you would like to give to the younger female colleagues, how they could arrange their lives or how they should proceed?
I'm so glad you mentioned this. I think, once I had kids is when I realized that really society isn't necessarily made for women. You'd really have to fight your way through it. We're different. We have different responsibilities, as you mentioned, different responsibilities, family-wise, household-wise. We are, taking some time away from work, to raise our kids, to be, right after you deliver, your baby. And so this is all kind of these hurdles or challenges you have to address. You're in the middle of writing a paper or doing this research collaboration, and then, you're pregnant or you have to give birth. And so it's these hurdles that you wouldn't really have expected, but it's also the best thing in the world. And so my advice would be, if you want kids, you want a family, definitely get started early and not, don't think about, work or challenges that you may face. Just go ahead and do it, and then you'll deal with it. Yeah. One of the best advice I got from one of my female mentors in Montreal in Canada is, if you want a family, focus on that. You'll always have time to get to, your career. Just focus. You can't do everything at the same time. We can do everything, but not at the same time. And so you have to prioritize, which we're not very good at.
No, yeah, but I think it's very important. You have to prioritize and you have to be organized. And I have the feeling that a lot of females are really well organized because they are always a little bit with these different things on top of their backs. They need to be a little bit organized. And one of my female mentors, I also had a female mentor. She was only working part-time, but she was able to do in her part-time more than the male colleagues in the full-time because she was so well organized and she was not spending time with nothing. So you had to walk next to her and she was educating you on the way to some other meetings. This was really brilliant and I really liked it.
It's very true, by the way. Do you know what? My colleagues make fun of me because while, in between patients coming in and out, you're dealing with emails. I'm usually doing my groceries online, and they just say, well, how many things can you actually handle at the same time? I'm not sure that I'm really handling them properly, but a lot is going on.
It's always said that men are multitasking capable, but you just mentioned that's not the way. I would, for some part of this discussion now, also move to patients, and not patients on the global level, but patients in Abu Dhabi. So are there differences if we stick to Crohn's disease, both in the disease presentation compared, for instance, to North America or Canada, where you have been, and also to the attitude, how the patient-physician relationship is this the same or is it completely different?
Yeah, this is a lovely question. So I think I'll start with a caveat that a lot of this is going to be my personal experience, but also experience of other colleagues. The reason is that we don't really have much research and we don't have much data in this region of the world. And that's something we can talk about. Unfortunately, it's very limited in terms of infrastructure and expertise in research. But what we see is essentially quite aggressive disease in IBD, and we're starting to have some data from the UAE. Patients have aggressive disease. They are more often on biologics. There are much higher rates of perianal disease. We're seeing patients with delayed diagnosis, delayed surgery. and we're seeing this in our clinics. It's tough because even though in the UAE specifically, we actually have access to all therapies, the question is whether your individual patients will have access. It's very variable in terms of access. And so it ends up being a very kind of, fragmented care overall. But there's just so much work to be done still.
I found it interesting because you said perhaps limited access or at least the delay to making the diagnosis. You have a very patients with very difficult diseases. What is the reason? Is this that you don't have enough facilities to do it, or is it the resistance of the patient, or is it the, let's say, not limited, but limited knowledge that there is an emerging disease and a lot of people still think it may be infectious or it may be IBS, or is it all of it?
I think it's all of it. If you look at data from across the region, the limited data is we do have delayed diagnosis, not only because there are, of course, in the UAE, we don't have any problems with infrastructure and you could get a colonoscopy probably the same day or the next day. But this is very variable in terms of how much access you have to healthcare and in the region. So there are areas that are much luckier than others. But what we do see is essentially this variable access to care in general. We're seeing, for example, a lot of patients that have IBD at the Cleveland Clinic in Abu Dhabi that have access to a lot of therapies, a lot of, nutrition, psychology, and all the kind of multidisciplinary care. Then you have other patients that are not as lucky and don't really have access to that.
How complicated is it to treat an IBD patient just with the background that there may be other diseases like other infections or other different variation of extraintestinal manifestations?
Yep. We do see that. So we do see delayed diagnosis, for example, because of entamoeba histolytica. We have been seeing that a lot. TB as well is not so much of an issue in our country, in the UAE, but it is an issue in that whole region where, obviously TB looks exactly like Crohn's disease, and that's been a really big challenge in terms of diagnostics. Entamoeba histolytica, we see this a lot. And so we actually see these patients that come with, they come to see you and they say, listen, I've had entamoeba histolytica 3 or 4 times, but they've had they've had literally disease for the past few months and nobody really figured out that this was IBD, complicated by entamoeba here and there. And so, this disease did not exist almost, or it was very limited a few years ago. And we really see an explosion of cases. And so the problem is patients don't think about it. Physicians don't think about IBD. Of course, that's changing. But in general, patients and physicians have this very low awareness around IBD.
You mentioned that there is emerging and higher numbers of IBD. Do you have an idea what is the reason? So is it the now westernized influence coming to Abu Dhabi, or what is the reason?
It's a great question.
Can it be the genes?
It's a great question, and I wish we obviously knew the answer to this. Actually, genetics, so we do see patients that have family history, but actually only about 10% of our families have family history. Most of them they're the first ones in their family to have this disease. And when you think about it, the UAE and the region has changed really dramatically over the last 50, 60 years. Industrialization, westernization of the diet, and that I think that has to have an impact. Our patients are very prone to eating, this quote unquote junk food, processed foods. It's really kind of invaded. The diet has changed. Local diets have completely changed. So there has to be something, related to that.
You mentioned that there is more aggressive disease, and you mentioned also higher number of perianal disease, and you told us there is not that much research, but you estimate how many of the Crohn's disease patients suffer from perianal fistulizing disease, because we know this is the most difficult part to treat.
So we do have a couple of studies from our center and another big center in Abu Dhabi where we have about 35 to even 40% of patients with Crohn's. With
really
perianal
high.
disease. It's really high.
Yeah.
It's really high. And if you combine this to actually something we're seeing in the clinic, and again, this is anecdotal, but a lot of patients are not going to mention it. they're not going to mention about their perianal symptoms. And so, or they think it's completely unrelated. What do you mean? The abscess I had 2 years ago? Is that what you're talking about? And so that's also another issue. So we see a lot of patients with underdiagnosed perianal disease. And it just, if you don't actually ask specifically the patient about these symptoms, it's not going to come up.
Okay. Before we come to an end, I would like to have one final question or part I would like to discuss. You mentioned that you have everything available. You are the pharmacy of the world. You can choose of everything. How do you choose and select individual therapies? How do you prioritize? Do you use guidelines? It's just your personal opinion. How is it done in the Emirates?
In the Emirates, okay. Great question. We do follow guidelines, and we've actually we've worked on the second set of guidelines recently. What you notice is, physicians in general, and I won't be talking specifically about Cleveland Clinic Abu Dhabi, but in general in the region, will try to follow guidelines. But sometimes, whatever is in the guidelines is not really representative of what you're seeing in front of you. And so you may think, okay, so I have to, treat to target. But they may, they don't take it with a grain of salt. They may take it to a whole other extreme, which is, oh God, they have too little after cirrhosis or after ulcers, let me, change therapy. So we do see this a lot. We see patients kind of cycling through advanced therapies, or also patients that are undertreated on the other side.
So you have, but you have a certain freedom. Cleveland Clinic Abu Dhabi can make things different than Cleveland Clinic in Cleveland or in London.
So we're very lucky at the Cleveland Clinic Abu Dhabi specifically to actually have access to all currently approved therapies. And so patients treated at Cleveland Clinic Abu Dhabi are essentially treated the same way that they would be treated in Ohio. We have access to a multidisciplinary care. Approach. The main thing is, choosing therapies will really depend on the patient, if they have extraintestinal manifestations, obviously whether, insurance coverage. So many things come into your mind when you need to choose a therapy, but we're really lucky that we have, everything available.
Sarah, this was really outstanding. It was great. I really enjoyed the discussion, especially about the gender disbalances and all the problems going along with this. I think we should definitely meet again and have another exchange. Thank you so much for being with us.
Thank you, Axel. It was really enjoyable. Thank you so much for having me. I really appreciate it.
And I thank the audience to listening for us. If you like this episode, please send us a lot of likes. A next episode on IBD Essentials will follow in 2 weeks. And stay tuned. There will be more interesting and exciting discussions coming soon. Thank you.